Well, it is just terrific to see everybody here today, and I just feel so happy about where we're at right now. You know, I think back, and it's really hard to believe that this is already my 4th annual convention. At the time, it's just gone by incredibly quickly, but it was back in 2010 where AHCA NCAL had just announced that I was going to be the new president and CEO, and Stacy and I came out to Long Beach. We were very excited. Excited because we knew what was next for us, but way more than that, excited because we believed so much in the mission. We were going to be able to continue our work to improve the lives of older people. But I will tell you, I was wrong about one thing. I thought this job was going to be really easy. I mean, I remember thinking, okay, we're running a state with a budget of $15 billion and 40,000 employees. How hard can it be to run an association with a budget of $30 million and 90 employees? You know, I met a lot of state execs at that convention. They just all kind of gave me the same smirk. I didn't know what they were trying to signal me at the time. I think in hindsight they were thinking, this guy has no idea what he's getting into. Well, I quickly found out that it wasn't easy. You may remember this. Stacy and I moved back to DC with our family in January of 2011. And then, just 3 months later, CMS issued its proposed rule for our Medicare payments for the next year, and in that rule, they decided that they needed to recoup what they thought was an overpayment, and they proposed to cut our rates all at once, 11.1%. It was the largest proposed rate cut in SNF Medicare history. Well, we worked really hard over the next 2 months. You know, hundreds of you came to DC and helped us out, and we worked extremely hard, and I think we came very close to getting that rule changed, but the bottom line is that we didn't. We lost. And on August 1 of 2011, CMS came out with its final rule, which in fact cut our rates 11%. I will tell you that I was completely devastated. It was the worst professional loss of my life. I was physically drained and almost sick. I really think it's the one time in the last 3 years of having this job where it almost worked against me that we had been in our facilities for 10 years running them, because it hurt so bad. You know, CMS would look at charts and numbers, and I would think about the cut, and I knew what it meant in our buildings. I didn't look at an 11.1% cut. I thought about the names and the faces and the lives of our residents, and I was really down, and people could tell it. Stacy was trying to cheer me up, and so she said, okay, Mark, a few days after the cut, she said, let's focus on things that we're happy about. Tell me the things that you're happy about in your life. And I thought about it, and I said, well, I'm just not happy. And she said, no, I'm not going to let you get by with that. Tell me one thing that you're happy about. So I thought about it a little bit, and I said, well, okay, I thought of one thing. I'm happy that when we moved out to DC, we didn't have the time to buy a house, and instead we're renting, because I'm not sure how long the members are going to want to keep me around. So I'm happy that we're renting. Well, from that very low point, we've turned it around. You won't be surprised to hear that immediately after the decision came down, I got scores of emails from members, most of whom I didn't know, saying, Mark, we know it's not your fault. Keep on fighting. Don't back down. We want to continue to work with you. Our board refused to back down. We had a board meeting in New York City that I'll never forget, just 2 weeks after the decision in August of 2011, where the board really chartered a new course. It said quite clearly, we're not happy with this decision, we expect better results, and we want you to chart a new course. And it told us to go into a different direction in 4 areas. First, the board said, let's become proactive. Let's not wait for bad decisions to come down from CMS and from other government groups. Let's figure out ahead of time what they're working on and shape those decisions before they happen. Let's be proactive. And we have been. The second thing the board said was, let's become the solution. Let's just not become one of those other 7,600 trade associations that says no, 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 no. Let's figure out real policy alternatives for the policymakers. Let's be the solution. And we have. Thirdly, the board said, let's be heard. We are sick and tired of sitting in the back of the room and listening to the docs and the hospitals and the pharmaceutical companies, and we get whatever little crumbs are left over at the end of the meeting, if there's any crumbs at all. we want to be heard. The board authorized a $4 million advocacy expense and said, go out and make some noise, and we have. And finally, the board said, we've got to unify the sector. If we have all these different groups and all these different people at CMS and on the Hill, we're going to keep getting results that we don't like. So Mark, we want you and your team to go out and try to bring people together, and we have. You might recall that the next convention was in Las Vegas, where we all agreed that we wouldn't back down. And from that very low point, we're starting to see some real results. First, we're bigger and better and stronger than we've ever been. As we all sit here today, we're a record membership. We have record membership at every level: assisted living facilities, skilled nursing facilities, not-for-profits, for-profits, big, middle-sized, small. At every level, we have more members than ever. And not only are we bigger, we're more united. As Neil indicated, the Alliance for Quality Nursing Home Care came back and merged into AHCA in July. And then on top of that, the terrific news with the Illinois Healthcare Association coming home. We are bigger and better and stronger than ever. And second, we're starting to see some policy results. Our goal isn't just to create a big organization. Our goal is to win for you. And we're starting to see some modest victories that make a difference. For the last 2 years, instead of the horrible market basket cut that we had in 2011, for the last 2 years, we've had clean market basket increases that have resulted in hundreds of millions of dollars being pumped into our sector. We've also successfully fought off tens of billions of dollars of proposed and misguided cuts where people wanted to eliminate provider assessments, block grant our Medicaid, cut our rates 4%, rebase it, you name us, they keep throwing it at us, and we've been able to beat it back. And our state execs during all this time have done a terrific job maintaining the Medicaid funding, and in some states, we're already seeing some increases. But what's really been remarkable over the last 3 years is the work that you've done. You have definitively proved that you are the solution. During this very difficult time of reimbursement and constant attacks that we've faced, you have actually gotten better. Thousands of you have embraced the quality initiative that Neil talked about, and the results speak for themselves. Readmits, off-label antipsychotics, staff turnover all down, resident satisfaction up. In assisted living facilities, resident satisfaction at over 90%. You refuse to back down, and we have made remarkable progress. So the question now becomes, what's next? We didn't back down, we've had some modest success, what should we do next? And what's next is that we must work harder. We can't take time to celebrate these modest successes, we must work harder, because the folks that were after us 3 years ago and all these past years, they're still after us. Despite everything that we've been through, every month there is a new proposed cut. Every week somewhere in the country, some state has some crazy reg that they've come out that they think will make things better, but they won't. We have to continue to fight harder. So on the quality side, that means that we ask you to continue your work on the quality initiative. If you're in the award program, continue your progress up to the gold level. If you're an assisted living provider, we hope that you will embrace the patient safety organization that we are launching this year. And on the political side, it's very easy to know what we need to do. We've got to work harder because we simply have to crush our opponents. We have to crush them. And we will do that in a variety of ways. The brilliance of our policy alternatives, the quality of work that you're doing in your buildings, and most important, the brute political force that I think that we now have because of the unification of the sector. So what I hope that you all do this week is I hope that you have a really good time. But I hope that after you have a really good time, we all jointly commit, just as we committed in Las Vegas 2 years ago to knock back down, we all jointly commit to go home and work even harder. Now, I told you that I was a little bit wrong about how this job would be 3 years ago, but I don't want to leave any doubt. I am extremely grateful to have this position. I am more excited and more motivated to work with our team to create wins for you than I was when I met you back in Long Beach 3 years ago. The work that you do in your buildings, the stories that were described by the prior speakers, make our lives meaningful. All the time back in DC as staff, we talk about how lucky we are to have jobs that really matter, because we know what's going on in your buildings, and we know the difference between winning and losing and what it means for you. So it truly is an honor to work with you. On behalf of the 90 folks back at AHCA NCAL and our 50 state execs, let me tell you that it is a real honor and privilege to work by your side during this epic battle. Now, let me just close by telling you one last thing. You remember how I told you that 3 years ago I told Stacy that I was happy that we were renting? Well, last June of last year, Stacy and I bought a house in DC. Because we want to be in this battle with you for a very long time. God bless you for everything that you're doing.